Dental conscious sedation is one of the oldest and most proven sedation methods in dental science. The treatment uses a standardized method, meeting the highest level of safety thanks to modern equipment, such as the Accutron Conscious Sedation System, which is very easy to integrate into daily practice. After the dentist has explained the procedure and discussed the patient's history, the first stage of the treatment with nitrous oxide is to choose a suitable nasal hood. Along with the size, the color and scent also play an important part in creating relaxed, comfortable treatment, particularly for children. Accutron offers an unequaled range of variations. Both children and adults can put on the nasal hood independently, increasing their acceptance of the method and the strangeness of the situation. During treatment, vital signs, such as pulse and oxygen saturation, are monitored continuously. The vital signs can be measured with a modern finger clip pulse oximeter, ultra precise and very convenient for patients and staff. The first stage of the actual nitrous oxide treatment establishes the respiratory minute volume. A rule of thumb, the first digit of the patient's body weight in kilos equals the respiratory volume in liters per minute. Nitrous gas treatment begins by administering 100% oxygen. It allows the patient to easily get used to breathing through their nose and wearing the mask. The pure oxygen is administered for around 2 to 3 minutes before nitrous oxide is mixed in. For infants, we recommend beginning with a nitrous oxide mixture of around 40%. Adolescents and adults are given an increasing dose of the nitrous oxide concentration. Titration usually begins at 10 to 20% and is increased in 10% steps at 1-minute intervals. While digital flow meters keep the respiratory minute volume constant during titration and during treatment with the analog flow meter, the entire flow must be adjusted through subsequent regulation of oxygen levels. A local anesthetic is usually required, even if nitrous oxide has both a mild analgesic effect and a strongly anxiolytic one. The subsequent treatment can take up to 4 hours under nitrous oxide. The patient remains awake and responsive, relaxed, and free of anxiety at all times.
The anxiety-reducing effect of the nitrous oxide makes it very easy to deal with children. The method is so very good, and it can help patients avoid full narcosis. There are almost no side effects, hardly any limitations. It also makes adult patients who dread going to the dentist easier to handle. The nitrous oxide relaxes them. Patients with a gag reflex resulting from psychological stress can be treated exceptionally well with nitrous oxide, as reflex is suppressed and the patient has no other defensive reaction.
At the end of the treatment, the nitrous oxide can be reduced to 0% right away. The subsequent minimum 3-minute dose of pure oxygen is important. This prevents diffusion anoxia. The effect of the nitrous oxide dissipates immediately. After a brief rest period, the patient can leave the practice independently and may even drive home.